Okay, so now after going to check my main line to make sure everything is okay, I'm going to wash my hands. Then I'm going to select the correct medication. And then before I go on to my first check, I'm just going to examine the bag, make sure there's no leakage, and make sure it's clarity, there's no cloudiness in the bag. And then the expiry date, check the expiry date, it says August 2028, and on the bag itself it says January 21st. So I can see that the bag is okay. So then I go on to do my first check. So my first check with the medication to the MAR is Sid Garland. Sid Garland is the patient. The medication I'll be administering is a saxazoline. Dose is 500 milligrams, and 50 milliliters of normal saline. The route is IV. Frequency is every 8 hours. I'll be administering this medication at 6 a.m. in the site of the patient's left hand. And the reason for this medication is due to Sid Garland having a surgery in his left leg, and his left leg being amputated, and this is to just prevent any bacteria or infection. So moving on to my second check, it says Sid Garland. The medication is a Sufaxazoline. The dose is 500 milligrams. 500 milligrams is what's labeled here on the medication. The route is IV, says IV here. Frequency is every 8 hours. And I'll be administering this medication at 6 a.m. in the site of the patient's left arm. And the reason for this medication is due to Sid Garland having below the knee amputation in his left leg, and this medication is to prevent any infection or bacteria. So after I do my second check, I'm going to take up a blank paper and I'm going to go ahead and do my equation. So for the drop factor, it's going to be volume over time times the drop. So the volume is 50 milliliters. And the time I'm going to be infusing is 45 minutes times the drop. And the drop is labeled here, which it says 10. So 10 drops per milliliter. So I'll take my calculator, and it says 50 divided by 45 times 10, and that's going to give me 11 drops per minute. And then I'm going to find out how long I'm going to infuse this for over an hour. So it's going to be volume over time times hour. So the volume is going to be 50 milliliters over 45 minutes times 60 minutes, and that's going to give me 50 divided by 45 times 60 gives me 67 milliliters over an hour. Okay, and this is my equation. So my drop is going to be 11 drops per minute. After doing my math, I'm going to flip it over. I'm going to do my third check. So my medication said it's Sid Garland. Medication, it's a Cefaxazoline. Dose is 500 milligrams. The route is IV. Frequency is every 8 hours. The site I'll be giving this medication is the left hand, in the patient's left hand, in the IV site, and I'll be administering this medication at 6 a.m. And the reason we'll be administering this medication is due to Sid Garland having surgery on his left leg being amputated, and this medication is to prevent any bacteria or infection. So I'm gonna go ahead and do my final check. So the drop, so volume over time times drop. So the volume is 50 milliliters over time, 45 minutes times 10 which is right here, 10 drops per milliliter. And then do my calculation. So 50 divided by 45 times 10, gives me 11 drops per minute. Okay, I'm gonna do it over hours, so going over time times hours, so 50 milliliters, so 45 minutes times 60 minutes, so 50 divided by 45 times 60 gives me 67 milliliters per hour. This there. And after doing that, I'm then going to look over my next and compare them. So my answer is independent check. Okay, perfect. Wash my hands, and then I'm going to go ahead and open my I sanitize my hands, wash my hands right here. I'm gonna take this sticker off, and then I'm gonna unwind, and then I'm automatically gonna lock this. So it's locked. I'm gonna take my medication, and just using sterile technique. Put that there. And then I'm gonna just put the medication in. And there we are. So after doing that, I'm then gonna gather this, my worksheet, along with lips, and then I'm going to go to the patient's room. This is right over here. So first thing, so I'm gonna wash. So first thing I'll do is go in, wash my hands, introduce myself to the patient. So hi, my name is Katie Ann Bell. Today I'll be your student nurse today from Durham College, and today I'll be administering your medication. It's a saxazone. It's for to prevent any infection or bacteria due to your surgery in your left leg. Is that okay with you? He says yes. Okay, before I get started, I am just going to go ahead and ask you to verify your name for me. So on my worksheet, I'm going to verify his name to his wristband. Said Seth Garland. Okay. Said, do you, what's your date of birth? Tells me date of birth, 11/08/1965. Okay, and are you allergic to any, and do you have any known allergies? He says yes, penicillin and codeine. Okay, said when you do have this this allergic reaction, what's the history of your reactions? He tells me that he just has a little itchiness. Okay, so after doing that, I'm just going to go ahead and check your environment. So that your bed is in the lowest position, your room is cluster free, your 2 rails are up, the 4 brakes are working, your air pressure is working, your suction, and your oxygen is working. So after doing all that, I am then going to go to the main line. Hope you can see here that I have. And then the first thing I'm gonna do is lock the main line. So I'm just gonna lock it. So it's locked. I'm just gonna put this hook right here for now. So after locking it, and then I'm gonna take my alcohol wipe. cleaned it, attach safely. And then, since this is locked, I'm just gonna go ahead and make it run and fill up my vial. Okay, perfect. Then I'm gonna go ahead and had my medication bag. I'm just gonna go ahead and drop the mainline bag. So drop the mainline. And then I'm gonna go ahead and I'm gonna open. So you see that my main bag is lower than my medication. And then I'm gonna go ahead and use my stopwatch to calculate 11 drops per minute. And then you see it dropping. Okay, let's try it for a full minute now. One. Okay. Okay, this is that slow down. I'm just gonna go ahead and look a bit more. Although it's already at the line. Okay. So with 15 seconds. Okay, so starting for a minute. So now 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay. to double check. One, two, three, okay. One, two, okay, so start off with